This original WSRE presentation is made possible by viewers like you. Thank you.
Right now on The Aware Show, what it means to be shell-shocked after experiencing or even witnessing a traumatic event. We're taking an up-close look at post-traumatic stress disorder right here on The Aware Show. Hi, I'm Dee Dee Sharp. We're glad to have you right there with us. PTSD, although it's often associated with wartime and veterans who suffer from post-war traumas, it's a complex disorder because just about anyone who experiences or even witnesses a traumatic or life-altering event can actually suffer from post-traumatic stress. That includes victims of rape, childhood molestation, car accidents, and many other traumatic events. Well, here on The Aware Show, we want to talk about this mental health disorder, sometimes referred to as an invisible injury. PTSD can be so devastating to people who suffer from it that it has actually led some people to commit suicide. So it's very serious. Well, tonight here on The Aware Show, we want to focus on PTSD, as I mentioned. We also want to examine the effects that it has on the people who suffer from it and their loved ones. You may be surprised about what you learn about post-traumatic stress disorder tonight. My guests include Dr. Irvin J. Williams, Director of Specialty Programs at the Lakeview Center. We also have Dr. Kelcey Killingsworth, Mental Health Counselor. We also have Sam Taylor, a mental health counselor and sex addiction therapist. Both Dr. Killingsworth and Sam Taylor are with Cordova Counseling Center. And last but certainly not least, we have Nathaniel Bass. This man is incredible. He is the Director of the Veterans Services with the Gulf Coast Veterans Advocacy Council. He's also the District 1 Service Officer for Veterans with Foreign Wars. And I guess what's gotten me so excited is that he carries, rightfully so, a Bronze Star. And we should be showing a picture of him instead of me because that is a tremendous achievement in a lifetime to have a Bronze Star for service. It means that this man, in a heroic action in his service to his country, was able to save lives in wartime. We're going to talk about that in just a moment. But first of all, I want to thank all of our dynamic guests for being here on The Aware Show with us. Want to start, I've been saying it over and over again because I guess I've really wanted to bring this home for our viewers. Post-traumatic stress disorder and just about anyone who has suffered a trauma can be a person who has suffered and suffers from post-traumatic stress. And as long as trauma has been around, PTSD has been, but for the most part, people associate it with our veterans, people who are coming back from war. So we'll talk about that. But we also want to talk with you all about what it means for people who suffer traumatic events in their lives and who deal with this mental health disorder. We'll talk about some of the symptoms, and we'll also tell people about some of the treatments, and we'll also help you if you have a family member who has this disorder, how you can help them and help yourself. I want to start with you because you, again, incredible, so dynamic to have you here on The Aware Show. Want you to tell us, they call you Nate.
They call me Nate.
A lot of people know you as the guy who heads up and coordinates the Veterans Day Parade and a lot of other things that you do in the community. You refer to our veterans as your babies, and you have a lot of babies. Tell us about that. I
have almost 693,411 veterans that we kind of represent in 2 regions. And this covers Mississippi, Alabama, Georgia, and Florida. I am the Director of Veteran Services for the Gulf Coast Veteran Advocacy Council. I file claims on behalf of veterans to the Department of Veterans Affairs, the Benefit Department. And I work with them through the hospital as well, too. I also give a little counseling. You know, one of my jobs is to try to get the veterans in to seek help for PTSD and any other type of issues, mental health issues that they got going on. So I'm out there in the forefront to try to get them into the VA system.
That's great. I want to talk to you personally. We're going to dig very deep.
Okay.
You are 100% disabled veteran yourself, actually 100+% disabled veteran yourself, and you also suffer from PTSD. I don't know how much of what has gone on with you would like to share with us here on the Aware Show, but I do want to kind of dig into at least the Bronze Star that you carry.
Okay, I served 2 tours over in Vietnam. I was with the 101st Airborne Division. I was infantry, and I was a door gunner. One of the reasons I was awarded the Bronze Star is because I saved 3 of my crew members' lives when we were shot down in Vietnam. And so I was awarded the Bronze Star. And I do suffer from PTSD. It's manageable for me. And of course, I have all type of mechanism that I can use for maintenance purposes for PTSD. I deal with my PTSD a little different than what some other veterans would deal with the PTSD. So I got it under control. So that's the reason why I'm in a position where I can basically help another veteran to get his PTSD under control.
Incredible, because some people would crumble even at that. I don't even know how many other traumatic incidents that you may have suffered during times of war, but certainly that in and of itself, a helicopter going down.
Right.
Yes.
Well, by virtue of me being in Vietnam for 2 years, so I've seen a lot. You know, I see things that I really shouldn't have seen at the age that I was. So it did affect me, you know. And so, but I had enough, I guess, help to go out there and seek help for my PTSD after I had got out of the military. So that's the reason why I'm in a little better shape than some guys that suffer from PTSD. The guys that's coming back from the OEF, OIF, and Operation New Dawn event, I really feel for them. I'm reaching out for them. I want them to come on in and get some help, because their war is different than what it was in Vietnam. Vietnam, we knew where the enemy were. They don't. So it's a big difference.
Very good. I don't want to be top heavy with the military so much, because, but I have to, because we have to be so grateful to you all's service and the things that you all do to sacrifice your lives for us and our freedom. So I do want to, in a way, but then I don't want to in the way that we're talking about PTSD so much, because I want people to understand that this is not a disorder of just war and that sort of thing. This is a disorder of people every day who suffer from traumas. And I want to turn to you now, Dr. Williams, as well as Dr. Killingsworth, for you all to tell us a little bit more from that standpoint, and we'll get to some of the symptoms and that sort of thing.
Well, you're right. It can happen to anybody. There are medical traumas. There are traumas related to abuse and neglect. They can be from children to adults. I mean, it spans all generations, and there are all different sorts of things that can happen that can lead to developing PTSD.
Okay. Dr. Williams?
I think we've become aware of some of the more extreme examples of PTSD or the events that cause it, but sometimes natural disasters. You know, we think where we live with hurricanes and all, and some people respond to that very differently in terms of what kind of loss that creates in their lives. And so as you were saying, I think it's important we look at the full spectrum of how that can come about, and also what kind of resources people have for dealing with it if in fact they are, not if, but as we all are impacted by trauma. And so understanding that that's kind of a condition of life, but we respond to it differently, and we have different resources for dealing with it.
Yes, and I know you're going to speak to us a little bit in just a few minutes about how, unfortunately, some people in dealing with this disorder deal with it with substance, that end up with substance abuse. So we want to talk about that. But I want to get you involved in this discussion as well, Sam, being a licensed therapist and counselor, and particularly with people who suffer from PTSD with even relationships, failed relationships and that sort of thing, which is something that people don't really think about.
No, they don't. It's often just the whole idea of loss. And what am I going to do in the case of divorce or in the case of cheating in a marriage? It's about loss and where do I go from here? And it's I see a lot of couples who have had betrayal, and I have suffered this myself in my relationship. And I work with them on, trying to mend this marriage back if that's what they're going to do. But the spouses of the person that the spouses who were the victims, or I would like to say overcomers after they get healing, are very wrought with all the symptoms. And it's very difficult when couples come to me because the spouse who has experienced this often is very, very uncontained. And so oftentimes before I can even counsel them together, I have to separate them because the person with if there's a sexual addiction involved or whatever, I have to separate them and treat that individually. And then we don't do marriage therapy off the bat.
Right.
That would be the wrong thing to do.
I think as our viewers continue to follow us here on The Aware Show talking about post-traumatic stress disorder, they're going to find that a lot of the symptoms and a lot of the things that are there underlying are indicative of what people go through with relationships, and as we're talking about rape, child molestation, even our veterans and that sort of thing, that there are a lot of commonalities there. But I think with you in talking about saying what you've gone through, yours was so deep and so distressing that you actually suffered a heart attack, which was in what you've learned, which was like a broken heart.
Yes, it was a heart attack caused from emotional trouble. It was a heart attack on a scale from 1 to 10. It was a -1, so there wasn't a lot of the physical damage there, but oh, the emotional damage was definitely there. And during my my trials, of trying to recover from this, I discovered a book, and it's Transcending Post-Infidelity Stress Disorder, and it's by Dr. Dennis Ortman. He is not saying that post-infidelity stress disorder is another disorder for the DSM. He is just saying that the symptoms that people present with who have experienced betrayal are concomitant with the post-traumatic disorder that's in the DSM.
And how long had you been married when you found out your significant other at that time was
I was married
unfaithful?
39 years, and I've been divorced, it'll be 10 years in June.
And how long had that been going on, do you know?
Pretty much throughout. There was more than one.
Okay. That betrayal,
yes,
certainly through those years of what you thought was a trustful, loving,
absolutely,
marital relationship. Yes.
And Dee Dee, I'd like to say too that I've studied betrayal from a personal point of view and clinically as well, professionally. When a person suffers or experiences betrayal, it is as though they have gone through a major medical illness. And of course, I did with a heart attack. But everybody doesn't have to have a heart attack, because just the emotional part of it is very debilitating. And it's very, very difficult, the symptoms.
We're going to get to that right now. I'm glad you mentioned that, and so that our viewers can see some of the commonalities with the ways that a person could get PTSD. So we're going to start with the PTSD symptoms, which we understand comes in 4 categories. And this information has been provided to us by the Mayo Clinic, and we're going to bring that up so that our viewers can see some of those symptoms in those categories. Number 1, intrusive memories. Number 2, avoidance. 3, negative thinking or mood. And then number 4, emotional changes and reactions. And now we're going to break that down even further. When we say intrusive memories, here's what we're talking about. If we can bring that up on the screen. We see recurrent unwanted memories of trauma, flashbacks or reliving the traumatic event as if it were happening again. Nightmares or being upset with your dreams or having upsetting dreams. And then lastly, severe emotional distress, physical reactions to memories of the event. Let's talk about any of those different, the categories being right now the intrusive memories. Let's talk about that. Dr. Killingsworth.
They come up all the time. You've had this thing happen, you know, and it's like a bomb going off literally for some people and figuratively for others. So the memories, they just come on, and a lot of times people cannot stop them. They can't interrupt them, and it's like being haunted. It's very difficult.
What makes this different from any other, maybe just daydreaming and having an intrusive thought or something? What makes this different, Dr.?
I think it's the stressful nature of it, and the inability to control it. Example, somebody may be, you know, in their bathroom looking in the mirror at themselves, and all of a sudden they see, rather than seeing themselves in the mirror, they're seeing the event. You know, it's intruding into their awareness, and it brings back that emotion, you know. And so it's not just I'm sitting here and I'm thinking or having kind of bad reflections and bad memories. Sometimes it's that much in your face, that difficult.
And Dee Dee, sometimes the memories can actually be good memories of the memories that you had with that person, but the tragedy in it and the difficulty there is that you don't have you don't have that person anymore. So there's a grieving that goes along with it too, and a huge sense of loss, especially after a long-term relationship.
Some
very
would say,
difficult.
is that more grief and loss than PTSD?
No,
I'm not a doctor, so I'm just saying.
Well, there is grief and loss in that, but I experienced the symptoms, the flashbacks, the dreams, all of that, all the symptoms that would qualify me as a sufferer.
And when we say severe emotional distress or physical reactions to memories of the event, when people hear that, they just, well, we heard the severe part, but how in depth does that go? What does that really mean?
It means severe emotional and physical distress. I mean, I have people come to me that think that they're having a heart attack. I mean, now you had a heart attack, but I have people who they think that they are dying in that moment. And the physical, the heart beating, racing, the blood pressure, I mean, they are in that moment and they feel like they're not safe. And so it's very real.
Okay.
And looking at it, the comeback perspective, you take a veteran who done been into a comeback zone, okay, he can't sleep at night. A lot of them pace, they can't sleep at night. They have anxiety attacks, okay. They have flashbacks, okay. They can't get this memory or this event that what traumatized them out of their mind or out of their system because they're dreaming about it, okay, and they can't sleep, so.
Oftentimes with veterans, I guess that's where we see and hear a lot of this. So I'm referring back to this, is you see the flashback where, you know, a noise or you know, something that triggers them into, you know, jumping under a table as to hide from the enemy or to fight from the enemy from a position to where they're going to be in that protective mode. I mean, so that's what we envision when people say the flashbacks and that kind of thing. But they're actually not just that.
Also, excuse me, something that Dr. Killingsworth mentioned, the issue of not feeling safe. I think that's another really important aspect of it. And it could be much less dramatic than like we just talked about.
Right.
Not feeling safe in my environment, not being able to, particularly if I've been abused or the trauma has been something of that nature, that I'm not safe in my skin. I'm not safe in my environment. I think that's another element that really is very difficult for people to deal with.
Let's move on here. And
Dee Dee, could I just say one thing about the flashbacks? I think we have to remember that flashbacks are actually dissociative states. It's almost like an out-of-body experience, and we can smell the smells of the person or the bombing or whatever it may be. We can sense, we feel that we're right back in that situation again, and it's almost like an out-of-body experience.
I'm glad you said that. I wondered at what point in this, I've been wanting to do this show ever since I came back to doing Aware last year, because I suffer from post-traumatic stress disorder from a very serious car accident I had at work as a passenger. And, you know, at this point, I feel like I can share that with our viewers with that, because for a while, it was the smell of just the, I don't even know what it was, certainly not the steam, but maybe from the antifreeze of the car. After the accident.
That's right.
And it was, you know, some of the other intrusive thoughts and things that you're talking about that you deal with, and where to put that. And Dr. Killingsworth, I want to take this time to come back to you and even ask you, when a person is having PTSD, you mentioned off camera that so often it can be confused with other problems that people have, and it makes it difficult to actually diagnose the disorder itself. I know that certainly was my case.
Yes, it can be tricky. A lot of times it kind of masquerades. It can just look like, oh, that's an attention deficit problem, or, oh, you just are having a panic disorder, so you're just having those anxiety attacks. But if you go through the evaluation and assessment process, or once you get to know somebody better and you can go back and you go, oh, all right, there was an event or a series of events, as the case may be. That's where it started. Okay, now we know what we're dealing with.
Gotcha.
But it can take a while.
Yes.
It takes trust. Sometimes people don't feel as though they can open up about something of
I
such
thought I
a
was
personal.
crazy.
Yeah,
I thought I was going. I thought I was losing. You know, I really didn't know what it was, and then there was the physical pain, of course,
yes.
that was going
manifests that
along
way.
with it. Yeah. So I really thought, you know, this was just something weird here going on, and it wasn't until I did get a chance to talk repeatedly with neurologists and psychiatrists and doctors that they were able to just say, you know what, at the end of the day, certainly post-concussive syndrome, but for sure post-traumatic stress
And it's
disorder.
very real. It's very real.
Very real, which is one of the reasons why I wanted to do this. And again, I'm so glad that you're here and glad you're there again. We're here on the Aware Show talking about post-traumatic stress disorder, what it is and what it is not. And right now we're going over some of the symptoms. And as we do that, I want to go to the second of these categories that are on the symptom list, avoidance. If you look at that, you'll see that a person will try to avoid the thinking or the talking about the traumatic event that they went through. They'll also avoid the places and the activities and the people that remind them of the traumatic event. That's the next thing. That's what they do. Don't want to be around anything that's going to remind them, but oftentimes that means shutting themselves off into a world that may or may not be good for them. Does anybody want to talk about that? Maybe you want to say something, Nate?
Well, yes, because you know, I deal with a lot of veterans, and I have seen how veterans react. They don't like to talk about that experience. They are withdrawn, okay? And if they're withdrawn within themselves, I mean, you just think how it would be for a family member. You know, the wife is trying to understand what's going on with this veteran. He wasn't like this before he left, okay? So he went over there, he didn't experience this trauma experience. Now he's coming back, he don't want to talk about it. He done shut down almost to a certain degree, and it makes it very hard for that relationship to continue. So
Gotcha.
So that's one of the things.
Dr. Williams, Dr. Killingsworth, you want to add anything to that?
I think there's other ways, like you say, in which people do that withdrawal or that avoidance. And in addition to the impact that it has on a family member, it's to some degree a protective measure. That if I don't think about it, if I don't talk about it, and that shuts them off from getting the help. You know, so that's the other side of that avoidance too. That's the difficult side for the individual.
I think sometimes too, you think that if you don't talk about it, if you don't think about it, you can get further and further away from it and separate yourself. And that's not what happens. That's not what ends up happening. What ends up happening, you don't end up getting the help you need early on to prevent it from continuing with other issues, bigger issues that can come from it.
Because Dee Dee, if you avoid things, you're going to separate yourself and isolate yourself, and that's going to lead to depression, which we see a lot of depression, as well as anxiety with post-traumatic stress.
Right. We'll talk about that in just a moment too, because that's going to lead us to the substance abuse problem as well, possibly. The third part of the category on our list of symptoms that we want to look at is the negative thinking, the changes in your thinking and your mood, which include negative feelings about yourself and other people, inability to experience positive emotions and emotional numbness, lack of interest in activities that you once enjoyed. You can even have hopelessness about the future, memories of problems including important aspects of the traumatic event, and difficulty maintaining close relationships. Exactly what we just got through talking about, a lot of those issues there. Do you want to anyone care to add anything to that, or we'll just move on to this last category? Go ahead, Nate.
Okay, sometimes it's a distrust. You know, a lot of veterans don't trust people to sit down and expose certain things to them because they wouldn't understand it. It may be a stigma placed on them in regards to their condition, or say a marriage, the state events of marriage. Now, I deal with a lot of veterans, okay, and I see them coming through my office, and my thing is to see that that marriage stays intact, and that's what I like to see, especially when kids are involved, okay. It's very important, you know, that that marriage stay intact. But majority of the veterans that I see is distrust. They distrust the VA. They distrust some of the family members, okay, and some of them distrust the wives. So it's a distrust factor.
That's very difficult to deal with.
It is, very, very difficult.
I can only imagine. And then another thing in all of this, I think, especially with me being at the time of this incident and having suffered and still suffer from it, you think that you're strong. Yeah. You know, you're a news anchor. You don't want people to know anything like that. For the longest, you know, you're not wanting to even talk about what you're dealing with because you're learning that it's a mental disorder, and you don't want to accept that.
Right.
You know, who wants to accept, you know, that? But until you face it and accept it, that's when you can begin the treatment, which we're going to talk about, and or the maintenance.
Right. And also, too, a lot of veterans feel like they don't want to be stigmatized, you know, with this condition. You know, a lot of them don't come forward to get that help at an early age. I mean, at an early stage of the incubation period of PTSD, and that's kind of bad too. So we try to, you know, we try to work with them.
Early intervention. Get in there and try to help them.
Exactly. That's what it's all about.
Let's get to this last symptom, and then we can get to some possible treatments that are out there for people, and also talk about substance abuse and what's being done in that area to help people who deal with PTSD. This last category that we're dealing with is the emotional changes and reactions that people can go through when suffering. It includes irritability and angry outbursts or aggressive behavior. It can also include always being on guard for danger. Yes. Overwhelming guilt or shame about the traumatic event. Self-destructive behaviors such as drinking too much and driving too fast. Plus, you can have trouble concentrating, trouble sleeping, as we mentioned, and even hypervigilance, the startling or frightening effect there. We could talk the rest of the show about just those things.
Exactly.
Because we could zoom in and focus on them. But in just trying to do an overview of them, what sticks out with you in talking about this last category here?
Well, I see a lot of people dealing with the hypervigilance. They're having a hard time dealing with their aggressive feelings, or they just have low tolerance for irritation. And it's difficult to work with. I mean, it's difficult to live with. It's difficult to be around. And you get the family members who don't know what to do or how to help, and the person doesn't know what to tell them.
Exactly.
And so it's hard. It's very hard.
Anyone want to add anything?
I think also
Dr.
the
Williams?
guilt issue that's mentioned. Sometimes even when a person is the victim of abuse, they have a sense of guilt about the event, or if they're a survivor and other people didn't survive. So that guilt piece comes into play, which also oftentimes keeps them from sharing what's going on with them, because they feel guilty about their role in it, or they survived and somebody else didn't, or did I bring this on myself? So a lot of different aspects of guilt comes into play.
Thank you for bringing that up. It's
Yeah.
very, very true. With our veterans, I can only imagine, Nate, just talking about hypervigilance, and you mentioned trouble sleeping and some of the other things, self-destructive behavior. We've
Self-destructive.
lost a great deal of people who suffer from PTSD.
That's right.
But I know, and if you want to share some numbers with us, we'd certainly take them. But I know for sure you're probably more up on the number of veterans that we have lost to suicide.
Exactly. Now, of course, VA did a study on the suicidal rate here. They also did another study because they wanted to be kind of a little bit more accurate with it, but those figures haven't came out as of yet. Now, I do know that last year we did have a high percentage of veterans who was committing suicide. You know, they was going through the depressive stages, and they felt that, you know, nobody didn't want to listen to them, and they didn't want to share anything, you know, with nobody to try to seek help. And so it's out there, and it's.
I think a lot of times it has to do with people not feeling that they're themselves anymore.
Exactly.
It's that grief and loss.
Exactly.
You feel that you've lost the person that you were prior to something like this happening. You feel like that safety zone that you talked about has been taken away from you. You didn't get a chance to give it away. Someone took it away, or something, that event took that thing away from you. And I think another thing about that is, you know, in the beginning of our program, I mentioned that this is oftentimes referred to as an invisible injury. Because people walk around every day and they look fine.
That's right.
But it's what they're dealing with mentally that creates the stress, and the stress that can create pain in the body and possible, God forbid, heart attacks, like what happened to you, and so many other issues that people go through. And the last part that I wanted to say about it is convincing. You feel like people don't believe you because they can't see the injury.
That's right.
And with any other disorder or disease, there's some type of physical way of knowing that it exists. And with this, the physical, you look fine. The physical, you know, may or may not be there. But people who know you know there's something different about you. You know there's something different.
That's right.
And those things can make people go over the edge if they don't get help.
That's right.
Let's talk about some of the treatment that's out there. For me personally, it's part of it is counseling and medication. I hate taking medication. I've always been the holistic person. I thought you could go to the Whole Foods store and get something naturally that could help you, you know, deal with your ailment. But with this, I haven't found that nature's cure. I'm a faith believer. I believe in God. And I worship God, and I go to church, and I'm very active in my church. That is in some regard the counseling, the big part of the counseling thing. But medication, I know we treat with that, and I know we treat with counseling. Let's get to some of that, Dr. Killingsworth.
We cognitive behavioral therapy is one that is used probably most frequently at this point to treat post-traumatic stress. I've got some training in trauma-focused cognitive behavioral therapy, which really put an emphasis on psychoeducation, so educating people, like just knowing that there was something real going on, putting a name to it and seeing the symptoms, and then understanding what's happening in your body, in your mind, and then, you know, teaching coping mechanisms, how to relax yourself, how to self-soothe.
How to breathe.
I
had to learn how to breathe again.
How to breathe,
Yes.
but how to soothe yourself. So no external soothing, no drinking, no drugging, no person, but calming yourself down, and then working through the trauma, you know, seeing what parts are still coming up for you, and then using all the skills that you've learned already to calm yourself down, so it's not scary anymore. It's, okay, I can do this. I have the skill set to get through this. And, you know, then it's maintenance. You know, it doesn't ever go away, but it's not as sharp. It's not as painful. And so that's what CBT does. A lot of times medication is needed. It's the same thing I would say if somebody has diabetes or high blood pressure. Sometimes that's just what you need. A lot of people try to muscle through without it. Great if they can. Okay if they can't. It's just the way it is for some people.
I think it's important as therapists too, never to underestimate the value of story when you have folks coming in, their story. I had a veteran not too long ago who came in, and it had been about 45 years since he had been, you know, to battle. And he was a highly decorated man in the service. And he had just mentioned the post-traumatic, he had just mentioned you know, that he didn't want to talk about some of those things that happened with him. And so I said, well, you know, he was there for another reason. But anyway, he came back. I told him, I said, you know, you have to have a safe environment. He said he's never breathed a word about what happened to him. And I said, you have to have a safe environment. I'm not going to force you, but I want you just to think about it. The next session, when he came back, he talked about everything that had happened. He had to kill people for self-defense and all of that. He was a different man. He walked in my office in a different way once he unloaded all of that. So story is real important to process that.
Okay. I'm getting an echo of I'm not sure where that's coming from. But
That was me.
oh, okay. You're agreeing.
No, I agree with her.
Well, that meant you were agreeing with her. Okay.
And that's true, because I have people coming in my office, and I got guys coming in there. You know, of course, the Vietnam War has been over for at least about 30 years now. But you got people that has not shared any of that experience that they have over there. So when they come into my office, if that's my first time they coming in my office, I try to make them feel comfortable, okay? And I try to gain their trust.
Gotcha.
And then once you gain the trust, sometimes they'll start opening up a little bit. And then the next time they come in, they're able to talk to you. And these are things that people, guys coming in there, they have never told their wives. They have never told their family members, okay? And so they've been embarrassed about it, they've been ashamed about it, they've been depressed about it, they're suffering from anxiety about it. And so they'll come in there, and I'll sit down with them, and I gain their trust. And so 9 out of 10, they'll open up to you. And so that's the reason I was saying, you're right.
Right. And that's why we heard you say it. Nothing wrong with that. Anything you want to add, Dr. Williams?
Well, again, thinking of what was just shared there, I'm thinking of a young man I worked with who came in for a substance abuse issue that had been in treatment for quite a while, and he didn't talk about some of his past history. And at one point, he had some really severe kinds of behaviors. He was very agitated. He was a lot of anger outbursts, just kind of with no provocation, really. And one session, he began to talk about having been brutally abused while in prison. He had talked about his prison experience and as a juvenile and so forth, but there was one particular event, and then he talked about how it was repeated, and he didn't see any connection at all between this other behavior and that event. But he got to the point of being able to talk about that And that just opened the door. I mean, so we were able to help him work through that, in addition to dealing with, he had become physically dependent on opiates, you know, as part of his journey. And so that was a major event for him in terms of him going down that road. So yeah.
I'd like to, excuse me, I would like to also just mention that, you know, we were talking about substance abuse, but I think we need to look at some of the process addictions that can come about as well, such as shopping addiction and sex addiction, gambling addiction, and workaholism. We see those also with, you know, because people that are hurting are looking for some way to medicate. And so they can choose drugs, alcohol, the chemical addictions, or they can choose process addictions. So I think we just need to add that little piece in.
I'm glad you said that, and I did want to give you an opportunity, Dr. Williams, to zoom in and focus a little bit more on the substance abuse of this, because if that's generally what ends up happening in many cases.
Again, you know, people start off with the notion of numbing the feelings or escaping from the feelings, or sometimes even they have a legitimate medical condition that may have even been caused by the trauma, and then the medication has its own course. You know, if any of us were taken to the hospital, given morphine for a period of time, our bodies would become physically dependent on it. And some people, when that medication was taken away, we say, I don't want to ever go that way. Others would say, you know, while I was in that state, well, I was feeling really good, okay, and let me seek it again. And so there's a lot of different courses that take people down that road, but oftentimes those medications, those drugs, allow the escape, allow the numbness, and then they take their own course in life with them, you know, in terms of the dependency that develops.
I see. I'm hoping that along the way, we've allowed viewers to understand a little bit about how this is diagnosed. I know we've gone to treatment, but just in case I missed that component, how do you doctors diagnose a person with PTSD as opposed to any other mental disorder?
Well, there are different assessments you can use.
Okay.
And, you know, there are very specific assessments. You can go through the DSM and tick off, yep, meets that criteria, meets that criteria.
Okay.
So the criteria that you listed. And then, you know, a lot of times it's not immediate. You know, it masks. You think that you're working with ADD, and it turns out you're working with concentration difficulties due to, you know, this has happened in the past, and now, you know, and now it's showing up this way. Okay. And there are other things. And it takes trust. It takes a working relationship with a therapist, or, you know, just somebody that you can trust. That's what really makes the difference.
Did you want to add anything, Dr. Williams?
No, well, like I say, I think the symptoms that you put up are part of what's used, as she says, kind of ticking off. It takes a number of these things, not just one or two. And so it's a constellation of symptoms, responses that gives you really the clear picture that it's this versus that. And that's where the professionals come in to help with creating that clear picture.
Okay. And one thing, too, that I wanted to mention, we talked about flashbacks and nightmares and that sort of thing, but I wanted to make sure we put this out here because this is a very important factor in all of this, of the triggers. I think we talked about how you, Nate, being a veteran of World War II, Vietnam.
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 Yeah, I'm not that old.
I was getting ready to, I'm trying to do the math, and I'm going, wait a minute, but hey. Okay, a Vietnam vet. Being a Vietnam vet yourself, and having worked with a lot of veterans, the triggers, you've talked about some of these things, but I wanted to zoom in and focus on it because I think that's the one thing that you can't be. For me personally, I'm not always aware of what's going to trigger it until it's already happened, and then I realize that's what it is. But if you can recognize the triggers, some of the triggers, then you can have like I guess, at the tip that it's coming. Right.
Well, it varies. You know, it varies because you don't really know how severe their PTSD is, what degree it is. And the trigger could be a word, it could be verbiage, insecure,
smell.
a smell.
The smell we talked about.
Yeah,
Right.
and you know, so a trigger, a trigger could even be just a backfire of a car for some people, you know, and so it depends. It depends on the severity of the veterans.
And I want to talk about that too, the severity, because PTSD is different things to different people, not just different traumatic events, but the severity. No two people will handle the same thing the same.
Right.
We're looking at a Vietnam vet, you know, who has done and you know, survived something that a lot of people would not mentally would be able to withstand. But yet you're sitting here and you've learned how to maintain and cope, and you say manage it.
Yeah, manage.
Yes.
Yeah.
But other people aren't. So the variations and how you all are able to deal with this, how does that come into play?
Well, it looks different for everybody, and it depends on kind of what has happened too. Is it a one-time event? Is it something that was ongoing? Is it a history in the family of, you know, is it abuse? Is it neglect? Is it, you know, is it war? Is it an accident? And then, you know, for everybody it's different, and part of it has to do with your constitution before the event happens. So your I would say resilience before the event happens, and so a person with high resilience may have some of the symptoms and still be categorized as having PTSD, but it doesn't manifest as seriously as somebody else who maybe has come from a background of having already dealt with depression or anxiety or adverse you know, environment growing up, and then they have something else happen, and it's stronger. It comes through stronger. So yeah, and there's sometimes you're dealing with generational abuse, generational PTSD, and that can trigger something in a parent that is trying to help a child who has gone through the same thing, and they think, why can't this child get over this? And because I had to get over this.
Yes, that's the big
I
thing.
had to get over it, so why can't you get over it? What's wrong with
beat
you?
it out of you. It's not going to help at all.
No, not at all. But that's the same thing with other people too, though. I mean, and there's a comparison that should not happen.
Exactly.
Because it is different for everybody.
It is.
I got you, Dr.
I was just thinking that, you know, we all have a different pain tolerance, physical pain. And some people can take an aspirin, somebody else needs to take a stronger pill. Some people, like you, I don't like to take medicines. Okay. So the same kind of thing with tolerance for trauma, for stress, for anxiety. And so that's another thing that adds to what you're saying in terms of the severity. How people experience that trauma is related to our constitution, our resiliency factors that are already there, and something you mentioned earlier, the support system even after the trauma.
Oh, yeah.
So those things come into play. Sure.
I certainly can appreciate you, Dr. Killingsworth, in saying it could be the thing that broke the camel's back, the one that was it, you know. After everything else, that was the thing. But I do want to come back, and I want to talk a little bit about. We've discussed how this impacts family and loved ones and that sort of thing when they don't understand. It's hard for them to understand when a person who may have the disorder doesn't understand it themselves and is not getting help. So let's talk a little bit about how the generational PTSD or even, as we're saying, the family that's suffering with someone who has PTSD, the impact that it can have on them.
Okay.
Either anyone.
As far as the veterans components are concerned, is that the impact on a family is devastating. It really is. And of course, I hate to see it like that, but it is what it is. It makes it hard to kind of cope, you know, when you're trying to dealing with your mental issues, when you're dealing with insecurity, depression, you got a wife and kids that's depending on you, and then sometimes you're not able to come up to the plate for them. So, and a lot of veterans, they really loses it, and I would go to the point to say that could function as a trigger for some veterans.
I see.
When they're not able to take care of the family.
Right.
I work with a lot of homeless veterans, and I work with veterans who's on drugs and alcohol. And so when they come to me, I understand, you know, where they're coming from. And at that time, I try to give them referral if they don't want to go to VA, I tell them, let's try to find somewhere outside of the VA. Because some people just don't like or don't trust the VA system, and they rather come to and see you or you
At Lakeview or
that's right.
Cordova Counseling.
Before they come to the VA. So.
We're going to have some resource information, and at the end of this, the most important thing is whether you go to one of these agencies who's represented here on the set this evening, just get help.
Yes.
That's the most important thing. That's because while there may not be a cure, there could be an opportunity for you to manage it.
Learn
how to
maintenance.
I like the word that you coming from our hero.
Well, you know, I went to an extensive training period with VA for PTSD. It was at that time it was 27 weeks, and that's what we was taught, how to manage it. We wasn't going to cure it. Nobody wasn't going to cure what you didn't experience. So you can manage it, okay? And at the same time, you can have certain maintenance resources, such as your family, friends, you know.
Support groups.
Support groups.
I think the spiritual is very important
Yes,
too.
definitely.
I'm a
Of
Christian,
course.
and I know a lot of my recovery has been through connecting with the spiritual.
Well, I can tell you, after having first gone through my car accident 4 years ago, I was very frustrated because I was always a God-fearing Christian, and I still am. And to have people say, well, pray and it'll go away.
Yeah.
You know, it was like,
Not helpful.
that's not working. I mean, I believe, you know, but I can't, it's almost like trying to believe diabetes away or any other illness. Like you can't believe it or hope it away, you know. It's like you said, you have to learn the coping mechanisms.
That's
and if you have to have the medication and the counseling and the group counseling and you have to have family support.
Yes.
You know, and some of that group help, it helps to be around people who are talking and saying and looking and feeling the way you do, because they're having to deal with the same things that you're dealing with. Want to talk about suicide, because we know this is a big problem for people who deal with PTSD and other mental health issues as well. But I think we don't really think as much, I think, of people that deal with PTSD from the realms of sexual molestation or rape or some of the or the betrayal or that sort of thing as we do our veterans when we say suicide. But how do we? Sometimes our family and our loved ones are left with, I should have known. You know, how can they equip themselves, and how can we here on Aware make sure that they don't walk away feeling ashamed or like it's their fault that they may have lost a loved one who took their lives? What can we say to educate people about PTSD and or suicide? When do they need to get help to help prevent that?
Well, first of all, it's not uncommon for somebody who is struggling with PTSD to have suicidal thoughts, and that's one thing. People come in and they say, you know, yes, I have been thinking about killing myself, and they wait for me to react. And the thing is, with PTSD, that's very common to hear. So we go in, we talk about it. I mean, there's nothing that is off the table. So, you know, how often is this happening? You know, when is this happening? Is there a specific time when this is happening? Do you have a plan? Safety is first. I tell them, you know, anything is possible. You know, change is possible. You can feel better. If you are not here, then it's all for naught. Okay.
Very good.
So we start there, and then we talk about who the safe people are in their lives, because those generally are the folks. If they're with me 1 hour a week, they're with other people many more hours in the week, you know, their family. So who's a safe person that you could talk to when you're feeling particularly low, when you're feeling like you might hurt yourself? Who would take you seriously? Who would who would be with you in that moment? Who would take you to the hospital if you needed to go? Who would you feel comfortable having go to the hospital with you if you needed to go? And we just kind of list those resources, and I give people resources. I give them the Lakeview helpline. I give them the national helplines. You know, for whatever they're dealing with, just please talk to somebody, because you will feel better. Okay. You will feel better. That moment will pass. It may come again sooner than you want it to, but that moment will pass, and we have to get through that moment.
I gotcha.
And I think, you know, you're starting with the point of what families can do in terms of just recognizing some of these symptoms that we're talking about, and it's okay to talk about. Are you thinking about killing yourself? Sometimes we shy away from, if I bring it up, they're going to do it. You know, but when you see somebody that's not behaving as normal, that they're getting depressed, withdrawn, those kinds of symptoms that you've talked about and share with the audience, that people can say, let's talk about it. You know, if I may not be able to be your counselor as your family member, but I see something's going on, I could be that resource that she just talked about.
Very good.
Because the person that's thinking of suicide, I mean, they're already thinking of it. Right. You know, you do, as Irv said, sometimes people are so afraid to bring it up, it'll make somebody but they're already thinking it, you know. And they may not even be actively suicidal. They may be just having thoughts. I had thoughts of suicide. I wasn't actively suicidal, but I did have thoughts. Okay. I just didn't want to be here.
All right, that's very good. One of the reasons why I wanted to do this on the Aware Show wasn't just because I suffered from PTSD, but I also wanted our viewers to know what it is and what it isn't because of what we're hearing and seeing in the media. So I'm hoping that we've come together here to assemble a panel that can help recognize what it is and what it isn't. We have just 30 seconds for closing thoughts. Anybody want to go with that?
I would just say, if there is anyone who has suffered from betrayal, that there is help. This book is excellent, Transcending Post-Traumatic Stress. It gives all the symptoms, and it really, when you read that book, you won't feel crazy anymore.
Okay. Thank you, Dr. Killingsworth.
It is real. I mean, so the feeling empty and not like yourself and just not understanding what's going on, it's real. And so seeking help can lead to real benefits.
Thank you so much. Dr. Williams?
Help makes a difference.
Help
as you said before, gets help somewhere.
Okay, we're going to say that again.
And
lastly,
veterans, please get enrolled into the VA system for that help.
Okay. We thank you for all that you're doing for our veterans. We thank you for your service. We thank all of our veterans for their service. And as always on Aware, we thank our guests for joining us. We also thank you at home, as always, for joining us here on The Aware Show. And as we've said here so many times before, I want to show you the information on the screen as I say this so that you'll have time to get that information. On the screen there, we're giving you the information so that you can contact one of the centers who've represented here, from Lakeview Center, Cordova Counseling Center, and certainly for our veterans here as well. And as we've mentioned, whether you go to one of these places or whether you go wherever you can go to get help, we say get help somewhere. All right, well, again, we hopefully have made you a little bit more aware of PTSD, of what it is and what it isn't. Until next time, I'm Dee Dee Sharp saying, until the next time, stay informed and stay aware.